Hello, my name is Gabriella Stern. I'm the Director of Communications at the World Health Organization. We're here in Geneva at headquarters, and I'm really pleased to have my colleague Lindsay Lee here. She is an expert here at the World Health Organization on people with disability and related issues. So, in a few moments, we're going to go to your questions. I thought I would kick this off by asking Lindsay a few questions to start out with. So Lindsay, welcome.
Thank
really
you.
glad that you're here because there are a few issues as important as how people with disability can cope and live and preserve their physical and mental health during this COVID-19 outbreak. So perhaps you can start by telling our audiences why are additional considerations needed for people with disability during the coronavirus outbreak?
Yep, so it's a really important thing to consider. So we all know the whole world is impacted by COVID-19 at the moment, but it's important to keep in mind that this impact is felt by different groups in different ways. So people with disability themselves being a very diverse group, experience, I would categorize two categories of additional risk. So the first category being an increased risk of contracting COVID-19, and this is for various reasons. So firstly, some people with disability might experience barriers to implementing the basic hygiene measures that WHO and other institutions are recommending. So for example, perhaps they have a harder time having access to a sink or to rubbing their hands together, or perhaps they need to touch their face more often than other groups. They also might have more difficulty enacting social distancing, which we're all talking about so much, because they perhaps have to be in close contact with other people who support them in various ways. So that's one category of risk, a risk of increased risk of contracting COVID-19. There's also, for some people, an increased risk, if they were to contract COVID-19, of developing a severe case. So this might be because COVID-19, we have seen in evidence, can exacerbate existing health conditions, particularly those related to immune response or our respiratory function. And also we have to keep in mind that a lot of people with disabilities experience barriers in many aspects of the environment, but also particularly in the healthcare system. So existing barriers in healthcare unfortunately still exist and need to be mitigated during this outbreak.
Yeah. I'm just going to say a word about captioning. We are working on captioning for this broadcast, so it should be coming soon.
would come to pass if perhaps they provide some sort of support or care for you. Who else can provide that care? So that's one thing, so making a plan. The third thing, communicate. So make sure you are constantly communicating with everyone in your support network. It could be in person, but as a lot of us are sitting at home these days, via text message, via video chat. Make sure that everyone in your support network knows what you need, knows your health status, how you're doing, and also that the people in your network know each other as well, so that they can speak to each other in case they need to fill in for a particular need that you have.
And I suppose they had better know how they can both protect themselves and protect you, so they have to follow the public health measures that we and others
Exactly.
are recommending, so that when and if they come to see you, they're not bringing the virus in.
Exactly.
Or if you as a person with disability have the virus, that you're not giving it to them. So
Yeah,
it's
exactly.
very complex, isn't it?
And we all know everyone in our world right now has a responsibility to be doing all they can to follow these basic measures, no matter what your status is. So if you have someone coming to visit your home, ask them, say, hey, please wash your hands, first thing when they walk into the door. It's a time where we need to be willing to be a bit aggressive like that with people, especially if you're at a higher risk.
Yeah, and I would imagine that there are some people in caregiving positions who are reluctant to leave their houses and go and work with one of their clients. And so that actually is all the more reason why people need backup plans and backup plans to backup plans, perhaps, right?
Exactly.
So it's really complicated.
Yeah.
On the other hand, it sounds very, very doable.
Yeah. It's certainly, might not be easy, but it's important. And actually, once you have a plan in place, and it can help alleviate maybe some anxieties or some fears that you might have. It's knowing the facts and coming up with a plan is what's going to help people feel safe in this time.
Do you have thoughts on what both governments and disability providers can and should be doing right now?
Yeah, absolutely. So governments have a lot of responsibility during this crisis overall, as we know. And firstly, before I talk about this outbreak in particular, I want to say that governments have a responsibility in general of making sure that their societies are accessible to people with disabilities. That's an ongoing work that governments are doing more and more to make their societies more inclusive, especially within healthcare settings. So that's the first thing that governments should be doing, is always making sure that the services that are being provided, especially in this time, healthcare services, are being provided in an accessible way. And we have guidance on that. WHO has guidance on that we could talk about in more detail. But specifically during this crisis, governments need to be making sure that they're providing public health information in ways and means that are accessible to different people. So this means providing information in using different communication modes. So if you're putting out a text document on a website, you need to make sure that document has accessibility features. If you are putting out a video, you need to make sure that it is captioned, which we are trying to do with this video at the moment, and I'm being told that the captions are working now. If you're putting out photos and imagery, first of all, the images need to not be stigmatizing to people with disabilities, but they also need to be captioned and have some sort of description to them. And also, if you have information lines, hotlines, that people can call to get more information, making sure that those hotlines are provided in different means. So maybe you have one that's audio, maybe you have a video line as well, maybe you have an email or text line that people can access. So that's really important. So other things that governments can do, they can provide targeted measures to people with disability and their families. So this could be fiscal things such as making sure that people with disabilities and their families have the resources that they need to cope during this time, whether that's, and supplies like food, water, any medication or personal protective equipment. And they can also ensure that disability service providers, so such as paid caregivers, are also given priority access to protective equipment like masks, mask, gloves, hand sanitizers. Maybe I'll stop there for the moment.
And do you see a difference between a person with disability who might be in a high income setting versus in a low income setting? I think about this a lot as the coronavirus spreads to lower income countries where people live, they have less privileged surroundings, they might live many people to a room, they might live in remote rural areas, and the challenges there might be very different from in a place like Geneva where we are, or Singapore or New York.
Yeah, exactly. So, it's important to note that people with disability are everywhere. And WHO numbers show that actually most people with disability in the world live in low and middle income countries. So it's an issue that's extremely prevalent in these areas. And it's also important to note that the right to healthcare and the rights of people with disabilities are not subject to a particular income level of the country, right? So you have the same rights in low and middle income countries as you do in high income countries. But like you say, the types of adaptations that people might make to participate fully in the society might be different, or maybe perhaps in high income countries, people might have more access to paid care, where in low and middle income countries, there's more of a community care that's provided. So you really just have to think through in your own setting, what are the services and the support I have available right now? What can I do based on what I have to ensure that I'm protecting myself in this outbreak? And you can do that no matter where you are.
Yeah. I'm just wondering if we have questions from the audience yet, and I'm just going to check, and if we do, I will take them, and if not, I have a million questions for you.
Great.
Okay, so here's one. So how can communities support people with disabilities in this outbreak, both in terms of things like you said, checking in, but also checking in physically or remotely, or advocacy, or any kinds of things, errands?
Yeah. So actually, you've already begun to answer my question. So, but I would say even before all of that, the number one thing that you can do to protect vulnerable people, whether that's people with disability or other groups in your community, is to make sure you're following the basic protective measures. So make sure you're washing your hands, you're not touching your face. If you're sick especially, you're staying at home, you're maintaining social distance. Doing all of those things is already protecting people who are high risk, and yourself, obviously. But another thing you can do, obviously, if you know of people in your community who you suspect might have some sort of additional risk, check on them, like you said. So send them a text, see how they're doing, ask them if there's anything you can do for them. Even something like that, even if they don't take you up on that help, just that reaching out is going to help assuage any anxiety that might be there, and that person might then know, okay, here's another person in my life that I can call on should I need help. But other things that you can do if you are in a community and you're maybe a business owner, or you're the manager of some sort of workplace, make sure you're following WHO guidance about what to do to prepare your workplace for the COVID-19 outbreak. Or if you're for instance, a shop owner, and you're providing goods and services to the community, you could think about how you can target those services towards people with disability in your community. One good example of this that we have seen in some countries is some stores have decided to have designated opening hours just for older people or people with disability. because getting in, I think we've seen on the news some of these this chaos that's come in some of these stores. Getting into that fray of people trying to grab food is not feasible for people who, for some people who might have disabilities. So that's one thing you can consider.
That's a great idea.
Yeah,
That's a really great idea.
Yeah, it's a great thing that we're seeing.
Yeah.